Hey y'all, it's Mike Prasad here from Sigma Americas, and we're sitting down now with Amin Madani from the University of Toronto. You're a surgeon, but you're applying AI and machine learning and some other crazy technologies around optimizing and creating advantages in the OR.
Yeah, that's correct. It's kind of like Google Maps, but for surgeons.
It's an exciting space. We've talked to a lot of companies here that are in purely the virtual space, digital space. What you're doing is taking some really high-end technology and applying it to the physical, live, high value, highly critical environments. What are you doing, and tell me how you're doing it?
So basically, as you know, complications can happen quite a lot in healthcare, especially in the operating room. There's a lot of issues that happen, and complication rates are a lot more common than we think. And usually, when you look back at how did complications happen, it's usually something that happened in the OR. So it's not because a surgeon had shaky hands. It's usually because they made the wrong decision, or they had a lapse in judgment, and they used the wrong tactical approach, for instance, or they dissected somewhere they shouldn't have dissected, and that's kind of how errors happen. So a lot of us kind of took a look at this concept and decided, look, there's a better way to do things. Perhaps there's a way in which we can augment surgeons' performance in the operating room. And so this is where the world of AI and machine learning has been applied for computer vision in order to identify and make sense of the outside world. In this case, we're training AI algorithms to make sense of the surgical field in order to provide surgeons with guidance and tell them, look, don't go there, go here instead, or what you're about to do is really dangerous. You may want to be careful about that. So that's kind of in a broad sense what we're doing.
Interesting. So you're really providing some assurance and awareness for the surgeons in the operating room.
Yeah, exactly. And the truth of the matter is, you have master surgeons who are really experts in their area, but they're not sort of everywhere. Like here at the University of Toronto, we have some of the best surgeons around the world that work here, but the moment you go outside of that environment, you're not going to have that expertise always available. So it's about replicating the minds and the mastery and expertise of these surgeons, not just one, but multiple experts from around the world into these algorithms, and then disseminating that to every operating room around the world. It's kind of like democratizing surgical expertise, bringing expertise to places that don't have it, and that way. So if I'm a surgeon, I'm operating in somewhere in the middle of the night doing a tough case. It's not just me doing the surgery. It's like I have a panel of experts standing over my shoulder, watching me, guiding me, and providing me with the support that I need to get through that difficult operation.
That's exciting, and I would think that you can never have enough experience in such a critical operation. The consequences of any deviance or unexpected situation are high, and so being able to augment a surgeon of any experience level with just more experience is always going to be a pro.
Absolutely, and you can't be too experienced to provide yourself with additional decision support. So I think tools like this could be used quite ubiquitously, regardless of what your environment you're in. Even if you're the most experienced surgeons, there may always come a time where you may have a lapse in judgment. So it's important to have these checks and balances in place to improve what we do in the operating room. Now, the flip side is how accurate and how reliable are these algorithms, and that's a totally different topic of discussion. But the important thing is to develop robust algorithms, and as long as surgeons understand the limitations of what that data augmentation actually is, that's I think where the key is.
Do you see that this acts as, in the current form, you see it acts as more of a caution type of mechanism versus explicit guidance, or do you see it getting to a level where it could be explicit guidance?
Well, that's a great question. We don't know the answer to that. I think we still have to do a lot of design studies and interview end users in their native environment and kind of see, like, look, if you have this AI algorithm, do you want it to constantly tell you what to do, or do you just want it to kind of be quiet and only come upon request, or do you want it to be something that tells you, more actionable things to do, or more tell you only when you do things that are really dangerous? I think these are all kind of questions and investigations that we still have to do. The algorithms that we kind of did for our prototypes is for gallbladder surgery, but basically it tells you where the fly zones are and where the no-fly zones are. And so you can have both information, and maybe it's up to the individual surgeons to kind of decide what they want to have available at all times. So we're still working on that piece.
So this idea of situational awareness in this really precise context, tell me how it works. Is it something where a surgeon goes into the OR and there's a lot of input or digested data, scans and imagery going into it? Does that combine with live feed, or how does the data input work across the overall implementation?
So that would be the ideal world, and an algorithm that takes everything about the patient, their demographics, their genomics, the genetics, the CT scans, and also every single pixels on the monitor while we do the surgery. All that could be data that it can use and sort of interpret this avalanche of data to give us decision support. The prototypes we've developed so far purely use the pixels on the monitor to make sense and provide you with guidance. But in the ideal world, it has extra data that it incorporates into its decision making and into its into the calculus of telling you what to do or what not to do. Right now, we use our brains to take all that data and to decide. But the future of surgery will be systems that can take all that data and incorporate it.
That's super exciting. In the medical space, what I come across a lot is that when you come into a doctor's office, you're in the OR, as a patient, you're coming in with the immediate need for urgent care. What led to that outcome is probably a case history or amount of historical data that may or may not be present at the time of operation, the time of being seen, but is critical to understanding what happened and what the case is. Do you see the potential for technologies like what you're developing to not only augment the operational side, being in the OR and the actual procedure, but also giving guidance on what might happen or what could be possible complications or unknowns when that surgeon is going into an environment where they know what they're doing, but there's always unknowns. There's always things that could happen that they don't know about. Is that a possibility, and do you think that's something that can be achieved from the data being pulled in the OR right now, or do you think there's a long way to go for that?
I think it's within the realm of possibility, and certainly something we're striving for. The use case that we use is intraoperative guidance to tell you what to do, but certainly incorporating all that data can also be used to tell you what to expect post-operatively, what the complications might be. So if you decide to do one tactical approach, the AI can say, hey, I've seen this case many times, and I can tell you this is not going to work. They're going to end up in the ICU if you do this. Or I would suggest do this instead. That's kind of the future that we're striving for, and it's totally possible. We just need to have the infrastructure to do that. That's the biggest limitation.
But also, if you have the on-screen immediate data, you can also identify unknowns and things that seem out of place, correct?
Yeah, absolutely. You mean like in terms of the anatomy, or in terms?
Yeah, or even like as they're going inside, and there's sort of. I mean, again, I'm not a doctor, so I'm imagining opening up someone going in to figure out what's going on. You know what to expect, generally speaking, but there's always going to be some variation.
For sure, that's absolutely true, and that's why you want your algorithms to be trained on a very wide breadth of data. You don't want all the straightforward cases. That's easy. You want the more complicated, variable scenarios, and those are usually the ones that give people a lot of grief in the operating room. That's where the decision support is most valuable. So that's why we need a system that can capture all that data and bring it together. And one of the biggest problems we're dealing with is, we have data here in Toronto, but that's not anywhere near enough data. We need to bring data from all over the world together into one common registry and repository so that we can train algorithms that have seen it all, basically, seen every body shape, every scenario, every pathology. And that's kind of one of the biggest problems we're dealing with right now. Anyways, we've started a nonprofit group called the Global Surgical AI Collaborative, and that's the mission of that group is to, bring together data from all over the world into one common repository.
That's exciting, because what you're doing is helping every surgeon in the world bring a body of experience that there's no way a single human can have, and really reducing the risk for all parties involved, but also increasing the likelihood of, which you brought up, not even a successful operation, but a smoother recovery based on the most optimal way to proceed with the minimal type of negative effects.
Exactly, and it's not necessarily you have to do this. It's more suggestions and more guidance to provide support to people who might need it. And in the ideal world, and certainly something we're striving for, is something that's very easily accessible. So it shouldn't require expensive hardware. It should be something that can come from the cloud, into your operating room and provide you with support. And so far, our prototypes are working really nicely. So we're pretty excited.
That's exciting. What's cool about AI, I think, especially given in this context, is that getting it to something that is trained and with enough body of data to be precise in dictating or prescribing specific actions is hard. But theoretically, getting it to a point where you can minimize and at least create an alert around possible worst cases is probably a lower hanging fruit.
Absolutely, and certainly the one that we did for the gallbladder example is basically, the surgeon has to keep their dissection in a certain area of the anatomy. If they go too low, it can cause very major disastrous impact on patients. And one of the things it'll suggest to you is to never go in that danger no-fly zone. And so, if we can train more algorithms to do these kinds of things, I think eventually it'll be like an entire library of algorithms that can tell you to do all sorts of different things. And ultimately, to me, this is kind of like the Human Genome Project, where many academic groups came together and contributed to mapping out the human genome for all sorts of applications. The goal will be to bring everybody together to design AI algorithms that can see the human body from different vantage points and be able to do so many different things. And this library of AI algorithms is what will be really the dream here.
You see, that's exciting. You see that in computer vision, where allowing, let's say, autonomous driving, allow cars to see areas where they don't have actual visibility on because there's data around it to create the model and then know what's coming up. Doing that in the human body is just a wild, but also very amazing a goal. And even if you just minimize the worst case scenarios, that's literally saving an untold amount of lives.
Right. Well, that's the thing. Even if you can prevent one injury out of like 10, 100, even that I think is worth it. But obviously, the more we can do, the better. And it's interesting you bring up automobile industry, because it's a little bit more challenging. Unfortunately, in the human body, the structures are not well delineated. It's not like annotating cars and pedestrians and things like that. Like, the anatomy is kind of hidden in the sea of fat and fibrous tissue. So you kind of have to know where you're going, and you have to be able to pick up on subtle cues in the operating field that, oh, this thing is kind of hidden underneath there, and kind of know what to expect underneath this layer of fat. And so that's kind of part of the challenge of doing surgery, I guess.
I'm probably oversimplifying there, but no, you're right. And in a lot of cases, there's no actual visibility.
Exactly, and so that's where having augmented reality support to provide you with guidance would be really cool, in my opinion. A lot of the surgery we do is image guidance, so we make these keyhole incisions where we put a camera inside and you've got a monitor, and you do your surgery while watching a screen, essentially.
Laparoscopic type approach.
Exactly, laparoscopic, minimally invasive surgery. So that's a low-hanging fruit where we can provide that augmented reality on the screen. Now, open surgery, the traditional surgery where you go with your hands and you do things, that's a bit more challenging. How do you provide that augmented reality? The world of, the technology is advancing, and there will be nice augmented reality platforms and glasses that we can have in the future, but until then, we're kind of limited in terms of that.
This is super exciting. I want to talk more about this, because personally, I'm just really interested in the space. Laparoscopic surgery, low-hanging fruit, you said, because you're going in, you're already using screens to see what you're doing and operate. We're trying to see that also develop in the space of remote surgery and surgery robots, for example. Is that I think that's a pretty straightforward application of what you're doing.
Yeah, absolutely. I think those are two different things, though, you mentioned. The robot, right now it's like a fancy marionette, essentially.
I mean the remote surgery.
Remote surgery, right. So not automation, because that's a totally different area.
Not automation, but where you have a certain operating, so they're already looking through a screen, they're already looking at, they're not inside, so to speak, in hands, whether it's laparoscopic or not.
Well, you can. I mean, a robotic surgery right now is image-guided surgery in a way, and that technology already exists. You don't really need machine learning for that. You just need really good connectivity and the right hardware to be able to do surgery remotely. Like that already exists.
Well, but applying a lot of the algorithms and what you're developing would probably be pretty straightforward in that scenario because you're already looking through a screen, you're already operating through a screen.
Exactly. It would be the same concept, but basically a different platform, but still the same augmented reality. Now, automation is a totally different area, and that's actually still something that people are looking into. And there's recent papers that have been published that have shown robots capable of doing technical things and with tissues and things like that. We're still very far off until that point. Right now, the future of surgery is probably a platform that'll augment a surgeon's performance, or something that the surgeon will say, okay, I want to do this, and it'll kind of do that for you under the guidance of the surgeon. So that's kind of where we're seeing this future of surgery. Like you're not going to see a bunch of Terminators walking around the hospital and doing surgery.
Well, I think the idea of taking existing technology where surgeons are going in, they are operating through a screen, adding your data layer over it to provide the guidance, makes so much sense.
It does. It's kind of like it's common sense. It's surprised we don't have it till now, but I think the technology has advanced to the point where we could do some of these more nuanced computer vision tasks. I think there's several things that have happened. Number one, computer vision has expanded quite significantly in the past 5 years, so that in and of itself is huge. Secondly, we now have the capability to actually collect data. Surgical data is very difficult to obtain for privacy reasons. Just recording videos is challenging. Having people annotate videos is challenging. So all of that is kind of like the perfect storm that's brewing and providing us with, enabling us to do this.
Super exciting. Well, this opens up so many possibilities. I think once what you're developing comes to fruition, and the ability to share and increase accessibility to knowledge and capability is exciting. Thank you for sharing that with us. One last question. So you're here at SIGMA Americas. It is very much a primarily blockchain, iGaming, affiliate, decidedly non-medical technologies. Anything you've seen here that's excited you or maybe even relevant to what you're working on?
Well, it's extremely relevant. I mean, all of this is very multidisciplinary, and there's a lot of cross-pollination. Like my background, I'm not a computer scientist or anything like that. My background is in understanding the minds of expert surgeons and optimizing performance in the OR. And then there's this entire world of computer science that has developed, and so we're applying what they have done in machine learning and AI and putting it into the operating room. So everything around us is applicable. Even blockchain is applicable. One of the major issues is going to be, how do you track who owns surgical data? Every single annotation, every algorithm, data provenance, all of those are key questions, and blockchain, I think, has a big role to play there as well. So all of that stuff is, I think, going to be relevant to our field.
It's incentivizing and making it financially viable for people that want to share that data and make it make sense. That's a great point.
Well, yeah, I mean, that's one of the big obstacles that we're facing is, how do you incentivize a hospital or a surgeon or anybody to just spend the extra bandwidth to take their videos and upload it to a registry for AI? It's a lot. And surgeons are not very forthcoming about recording their videos and just giving it to people. So there's patient privacy issues to consider as well. So all of that is going to require an entire multidisciplinary group of people to figure out. So
very exciting. I think there's definitely something there. And your work has been amazing. Hearing about it's been amazing. Thank you so much for coming and sitting down with me.
Thanks so much for having me.